For months, thousands of residents in Indiana nursing homes have been isolated. Despite a state program that aims to increase visitation, checks and balances are limited. As Brock Turner reports, Indiana's Facility First policies are hurting both residents and their caregivers.
Vicki Ayers fights back tears as she remembers her mother, Carolyn, who died just a month ago.
She loved to travel and eat out, and we would take her out several times a week for outings, and when they locked down, that was over. They wouldn't even take them out in the facility bus for a drive around or anything. They took everybody and made their worlds that were small even smaller.
Ayers' mother lived in this Delphi nursing home, just up the road from her and her husband's farm. When the pandemic began, Ayers says she considered moving her mom out of the facility, but she was concerned because there wasn't an accessible bathroom in her home.
I didn't feel like, at the time, that it was the best thing for her or for my family. I didn't feel like I was set up properly in my home to be able to have her here. 6 months later, knowing what I know now, do I wish I had done that? Yes.
The situation quickly spiraled. Ayers says staff at the St. Elizabeth Healthcare campus kept her mom isolated in the facility's COVID-19 wing for weeks, even after she tested negative multiple times. The company, which is one of the largest nursing home operators in the Midwest, declined an interview and did not comment on the facility's policies, stating that it would be an invasion of resident privacy. According to Ayers, it gets worse, though. She says her mom and other residents went months without receiving a proper shower, and staff restricted visits, even window visits, from caregivers. Andrea Smothers is the ombudsman who serves the area. She says nursing homes across Indiana have been forced to interpret vague guidance, and that's leading to significant variation.
The guidance that they were given, pretty much from our perspective as advocates, gave a lot of control to those facilities on how or when or under what circumstances they would allow visitors.
That visitation guidance from the Indiana State Department of Health was updated to reflect the latest federal language. It outlines clearer procedures, but sets a high bar for indoor visitation. For example, a facility is not recommended to resume visitation unless it has no new cases for 14 days, its county positivity rate remains low, and residents are notified. However, multiple Indiana ombudsmen who serve as advocates for caregivers and their loved ones say facilities are doing a poor job communicating these visitation policies and updating caregivers on the changes.
Those changes and that lack of communication, I think, builds a distrust by the caregivers, and that the facilities somehow have this power to just do whatever they want.
However, a state program designed to increase access to facilities is plagued with problems and inconsistencies. Instead of creating uniform visitation protocols, Indiana's Essential and Compassionate Caregiver Program has produced a patchwork of guidance that experts and caregivers say is poorly communicated and gives too much power to facilities. The department declined an interview for this story, but provided a statement saying, in part, recognizing the importance of this essential caregiver role, we have encouraged this in facilities. Applications are not required to be submitted to the State Department of Health, so we do not have any data on the number of applications accepted or denied. During the state's weekly COVID-19 briefing, the Secretary of the Indiana Family and Social Services Administration said caregivers can still file a complaint with the Department of Health if they feel a facility has wrongly denied their application or isn't meeting visitation requirements.
And we work very closely with the long-term care associations. We have biweekly phone calls with the long-term care facilities, work with them to really work through what does visitation look like? How can we do it safely? And when our surveyors go out, when our infection preventionists go out, they are seeing whether or not they're doing visitation. And of course, we always take family complaints or concerns, and we'll follow up on those. So thankfully, we have not really seen spread from visitation.
But families with loved ones in long-term care facilities know their time is limited. They're tired now how it is, and many don't have the resources or time to file complaints with the facilities or the state.
What we're doing is wrong, and it's wrong to an extent that I don't think most people are aware of.
Ayers and other advocates say they don't understand why more people aren't outraged that a policy made months ago out of necessity remains in effect, especially when rapid testing capacity is available for athletes, college students, and numerous other populations.
It is abuse. At this point, it is abuse because it is long-term. It isn't the short-term health crisis solution to the first month worth of the pandemic. We don't know how this is going to happen. Now, it's abuse.
And that's why she and others say they're going to continue advocating for visitation.
They could make it work. And it's not that they can't, it's that they won't. And that's wrong. So even though my journey is over with my mom, I have to speak for those people that are left.
For Indiana Newsdesk, I'm Brock Turner.